there are significant challenges in going on in health and social care. Some great opportunities as well, because it is about integration. It's about the two sides of care, if you like, health and social care, coming together, joining up so that they're producing better, more integrated services for vulnerable people. We know we have an increasingly ageing population. We have areas that brings issues for students and for practitioners in terms of, you know, the kind of models of care that we've currently got. Really not being fit for purpose.
Well, healthcare in general is in a state of flux at the moment, and I think it's really important therefore that people who are considering a career in this profession, which is a really important profession and getting more so, really have a kind of understanding of what are the kind of key issues affecting the profession and what sort of challenges they're going to confront when they go out into the world of work. So I think having a good understanding of the kind of funding issues and the challenges that they're going to be confronting is really, really important for students.
Get as much experience as you can before you go out into the world of work. The more things you've got on your CV, the more experience you have in lots of different settings. Go to as many different places as you can to get experience, and then you're much more employable.
It's important to understand funding and finance for the health and social care sector, basically because money makes the world go round, and no matter what job they go into, finance will play an important part. And particularly at the time when we've got budget cuts in health and social care all round, it's important to have that discussion now, so they're going in not to expect huge pots of money behind them to help them in their day job.
I always think it's really important that students debate the area that they are interested in, particularly in their chosen profession. And given that this particular area of activity is becoming increasingly complex, it's politically charged, and it's therefore really important, I think, because students, when they go out into work, will be in a very political environment, actually. I mean, there are really two different ideological approaches, I think, confronting the country at the moment. And people who are entering this profession, it's essential, I think, therefore, that they have an understanding of that and indeed can contribute to that debate.
One piece of advice to any student graduating would be to get to know the environment that you're working in. You will be working with the commercial sector, a statutory sector, obviously, and as well as the voluntary sector. So get to know the players that you're going to be working in that field, and get to know the potential partner agencies that you're going to have to establish links with ASAP. That's going to make you successful in your job.
We need new models, we need new kinds of services, and we need new types of workers. We need workers who are flexible, adaptable, who have a knowledge of both health and social care needs, who have that ability to go into organisations or create services, be innovative, you know, make a real impact, you know, on those services to really enhance the care of the future generations.